What that means is to figure out, just based on putting our hands on the animal, where is the problem. And that's so important because next we're going to order diagnostics and we're going to be set down a pathway to figure out what's wrong with this animal.
Dr. Jill Narak, head neurologist at UT's veterinarian school, presented neurological exams on cats and dogs in front of UT's Science Forum Friday afternoon. Narak said the way that our neuro exam will start out is to put the dog or cat on the floor and watch them walk around and how they interact with the environment. The neurologist also added that there are a few questions to be asked before an examination.
We start out by asking, is this first of all a disease of the nervous system, which seems really obvious, but it can be kind of the crux of the scenario sometimes. Then we try and think about what are the different ways that the nervous system can go wrong, because that's going to make us think about differential diagnoses or problems that the patient might have. And then we think about, well, what part of the nervous system is affected? That's the whole point, to figure out where the animal's problem is.
Narak discussed her patients and their diagnosis with such disorders as hemorrhaging, tremors, dislocations, bad reflexes, and paralysis. She also mentioned the things that they focus on while conducting a neurological examination on a dog or a cat.
And then we also have to consider things that are happening outside of the central nervous system. So we consider nerves that are going to limbs, also muscles, which are the end organ for all of that information. And then there's a very teeny little area just between the nerve cell where it ends and the muscle called the neuromuscular junction. And there are also a group of diseases that happen right there too. So this is how, when we're thinking about these different locations, when we're looking at the animal and trying to figure out which of those are affected.
Science Forum Vice President Dr. Sandra Tordos described the presentation as thoroughly understandable and well-paced. Tordos believed that a presentation like this can help attract certain individuals to the forum to learn more about science. The UT professor was interested in the speech because it touched on human development towards integration between human and animal sciences.
And we do have some pretty cool toys, just like in human medicine. We have MRI, we have CT scan, we have a bunch of different electrodiagnostics that we can do, spinal taps, all of that stuff.
Narak's examinations and procedures are similar to information found on vetinfo.com and vetneuro.com, two websites dedicated to animal disorders and treatment.
And I also just want to bring up again this concept of integration, of how we can work together with the basic sciences and how we can work together with the human sciences, or human medicine, and all come together.